Hi, my name is Aaron Turner, driver-operator with Palm Beach County Fire Rescue. Today we're going to be going over providing pet oxygen therapy to animals. It is an estimated that 63% of American households have a family pet, and a large number of those homes also have service dogs. Now, it's important to note that service dogs are not pets. They are actually working animals in the community. Some examples of a working animal are a dog who helps alert and protect a person who has seizures, a cat that helps an elderly person with depression, or one of the many canines that work alongside the Sheriff's Department and local police departments. In 2011, PBCFR responded to almost 1,300 structure fires. In a large number of these structure fires, we encountered many types of animals. Losing your home and property due to a fire is bad enough, but the loss of a beloved pet can be even more devastating. As a pet owner, I know that these animals are considered to be members of the family. Palm Beach County Fire Rescue also responds to a large number of animals locked in vehicles. And since we are in South Florida, these animals are always at risk for heat stroke and possibly even death.
They are the company that have chosen to make a donation today of these oxygen masks.
Due to the generous donations of pet oxygen mask kits by private citizens and businesses, Palm Beach County Fire Rescue has the ability to assist these animals in need. As of May 2012, all the district captain's apparatus will be equipped with this life-saving piece of equipment. Now today we're going to take a look at what is in these pet oxygen mask kits, and we're going to go over the proper use and care for this life-saving piece of equipment. But first, I'd like to take a few minutes to talk about the importance and the roles of the service animals in our community. Now there are a variety of roles that animals serve in our community. Animals can be used as service animals, used for animal-assisted therapy, or used for search and rescue. The training and costs for some of these animals can range in the tens of thousands of dollars. Service animals are animals that are individually trained to perform tasks for people with disabilities, such as guiding people who are blind, alerting people who are deaf, pulling wheelchairs, alerting and protecting a person who is having a seizure, alerting a person with diabetes, or performing other special tasks. Service animals are working animals, not pets. Search and rescue dogs are used by urban search and rescue teams, fire rescue, law enforcement, and the military. Specific applications for search and rescue dogs include wilderness, disaster, cadaver, avalanche, and drowning search and rescue or recovery. The dogs can also assist law enforcement in searching for explosives, drugs, criminals, and missing children. A recent application used by the military was the Canine of the Year search dog Cairo. Cairo assisted Navy SEAL Team 6 in the capture of bin Laden. Dogs similar to this one have been sold for more than $400,000.
Heel. Good boy. Down.
Maybe some of you met or worked with one of Palm Beach County Fire Rescue's own firefighter-paramedic Steve Driscoll and his FEMA search and rescue dog Blaze. In the aftermath of the 2010 earthquake in Haiti, Blaze was responsible for finding a 2-year-old girl buried in concrete rubble for 6 days. Animal-assisted therapy is a type of therapy that involves animals as a form of treatment. These animals can be used in a variety of settings such as nursing homes, mental institutions, hospitals, correctional facilities, in the home, and in society such as being used during a natural disaster. Animals commonly used for therapy include dogs, cats, horses, birds, rabbits, and other small animals. For instance, a dog can be trained to help a military veteran with post-traumatic stress disorder. A cat can be used to help an elderly person with depression, or a horse can be used to help a child who has autism. I recently read a story about a cat named Oscar who wanders the halls of a nursing home, and when a resident is nearing their final hours, Oscar will sit with them until the moment of death. Here in our community, Palm Beach County Courthouse uses therapy dogs. And with us today is Deborah Berger from Canine Assisted Therapy. I want to thank you for joining us today.
Thank you for having me.
First, I'd like to ask you a little bit about your therapy dog, Dylan, and what are some of the services that he can provide?
Well, Dylan is a certified therapy dog. What Dylan primarily does is work with physical and occupational therapists with the disabled. What that involves is we use different pieces of equipment with him. We have harnesses for him that he uses to pull with. We have different types of backpacks that people put things in and take things out to work on their manual dexterity. he's got lots of hair, so they do a lot of brushing with him, which also works on their dexterity and their fine and gross motor skills. One of the other things that he does is he provides motivation to these individuals by walking with them when they're in their wheelchairs and walkers.
And that's great. We're glad that you and Dylan could join us today. And the second question I have for you are, what are some of the other kind of dogs in your at Canine Assisted Therapy?
Well, we have all breeds of dogs and all sizes of dogs. We have from Chihuahuas to, I think Dylan is our largest therapy dog, who's a Leonberger. But we have mutts, we have purebred dogs, just and everything in between.
That's great. I just have one last question for you. What are some of the requirements for your therapy dogs and some of the training that they have to go through?
All of our dogs in particular, have to have their American Kennel Club Canine Good Citizen, which is good intermediate obedience training. Then we do a personality and temperament evaluation on the dogs that determines if they're really suitable for therapy work, because it takes a special type of dog to do the work that we do. Then depending on that temperament and personality and what the dog seems to have some interest in, and the owner has interest in, then we place them accordingly. Some dogs are great working with kids, some aren't. Some are great working with physical and occupational therapy like Dylan. Some work well with autistic children. It all depends on what area of therapy that they're going to go into as to what training is involved with that.
So now we're going to demonstrate the use of the pet oxygen mask on a large animal, large dog. Dylan's going to help us demonstrate this. We want to get into our pet oxygen mask kits and choose the appropriate size mask for the animal. We have the large one here. Comes with oxygen tubing, and there's an inlet on the end, so we're going to go ahead and hook up our oxygen, make sure we get that flowing. And this is primarily if the dog has suffered any kind of smoke inhalation and he is still responsive. One thing that we need to do before we start applying the oxygen therapy is a dog may be like this when we're approaching them because they need assistance. So we want to make sure we restrain them before we start giving them any kind of assistance. And these come in the kits as well. So now that we have the dog restrained, we're going to go ahead and start our oxygen with a large mask. Remember, it's 5 to 7 liters a minute for oxygen on the large mask, and we're just going to put it over the mouth and nose.
Good boy.
And just hold it there and give them the oxygen. Now if the dog starts to pull away, clearly he's probably going to start feeling better, and that may be a sign that he doesn't really need to have any more oxygen therapy. Do you have any tips for us maybe as a handler if a dog starts to kind of pull away, and maybe what we should do as firefighters?
First of all, watch the teeth. That's going to be the first response of a dog that's under stress, and especially if they're in an unfamiliar area and you've just put something over their face, they're feeling threatened. So basically, once they start pulling back, I would just kind of stay out of their way and visually watch them and make sure that they're okay, and keep them at the leash distance away.
Okay, thanks. And after we've assisted the animal, hopefully animal care and control has showed up at this point, or if the homeowner is on scene, we can hand over the animal to the homeowner, and they can get more care for them by their veterinarian. Next, we're going to be demonstrating the use of the oxygen mask on a cat. So joining me now is Gabrielle Mirage and Leo, and we're going to go through what's in the oxygen mask kits, and we're going to show you how to do oxygen therapy on a cat. What's included in the kits, we have 3 different sizes of masks. We have a small for small cats or dogs like pugs that have flat faces, ferrets, birds. The second mask, medium-sized dogs, maybe larger cats. And finally, we have the large mask for your large dogs. The masks have an inlet on the end, which is for your oxygen. So when you're going to give oxygen therapy, you want to hook your oxygen up to the end. It also has 2 valves on the side. These are just open valves. Unrestricted exhalations and inhalations for the animal. So you're not going to restrict their breathing at all when you're giving them the oxygen therapy. And finally, as far as equipment goes, we have a harness for the dogs, or maybe cats, for restraint. Also included is a little quick sheet on the general use, different liters a minute for the different masks. With the small mask, you want to use those masks at 1 to 3 liters a minute of oxygen. The medium mask, 3 to 5 liters a minute, and the large mask is 5 to 7 liters a minute. All right, so now we're just going to demonstrate oxygen therapy on a cat. We're going to choose the correct mask, take the cover off. Remember, we're going to put our oxygen on the end, hook our oxygen up to our oxygen supply, and gently push the mask over the mouth and nose, and basically you're just going to hold it there and give them oxygen. So if you happen to have an animal that's not breathing and you want to assist their ventilations, we can use a bag valve device that we have for our human patients. With a smaller animal, same as humans, we're going to pick the appropriate size bag valve device. On the end, where the oxygen inlet is, you can take this off. And basically you can just fit your bag valve device right in there. And then what you're going to want to do is a little bit different with using this to assist their ventilations. The valves, like I said before, they're open valves, so we're going to have to cover them with our finger and our thumb while we're giving the ventilations. So that'll get a good flow. And that's basically it. And after you have used the PET oxygen masks, these are not disposable. Basically, you just want to wash these with mild soap and water. Do not put them in the dishwasher. It'll destroy the piece of equipment. And basically how to wash it, first you want to remove the diaphragm. And you want to remove the oxygen inlet. And just basically wash it all with soap and water. Let it dry, put it back together. And put them back in service. So I want to thank you for joining me today and learning a little bit about the PET oxygen masks and how to use them. If you have any further questions or you want to do any more training, you can either contact me, driver operator, platform 29, B shift, or you can contact your district captain and get some hands-on training with these masks. And remember, if you have given treatment to an animal and the homeowner is not on the emergency scene, contact Animal Care and Control so they can take possession of the animal. Thanks for joining me. I'm Aaron Turner. Stay safe.